Hey folks, welcome back to Ground Game. I'm your host, Sam Chapman. Today, I'm really excited to be talking with Amanda Gao, co-founder and executive director of Bendable Therapy, a nonprofit psilocybin therapy clinic based here in Bend, Oregon, that offers the full continuum of care from clinical preparation through administration to integration within Oregon's regulated psilocybin therapy program. Before starting Bendable, Amanda spent 15 years running organizations centered in high trauma spaces, from working with victims of human trafficking, military personnel, and youth in crisis. Then she went back to grad school to become a licensed therapist, specifically so she could provide her clients both clinical therapy support in combination with psilocybin therapy services. What I find most compelling about the unique Bendable model is the philosophy behind it. Amanda and her team really had a choice about what kind of program Bendable wanted to embody. And she chose, in my opinion, to do a really good thing the really hard way. Extensive preparation, deep integration, licensed mental health professionals throughout the entire process. And then on top of that, she ran a real world outcome study with Bendable clients to find out what was actually working. It included real Oregonians with real comorbidities, including nearly half of who are actively on some type of medication, the type of population that clinical trials simply don't touch. I'm not going to spoil the data outcomes for you. You got to listen to the episode. But the data this study produced is clearly building the real world case for integration of psilocybin therapy into the mainstream behavioral health system at large in ways that few other people are doing right now. But before we get into it, a quick word from one of our show's sponsors. This show covers a lot of ground: regulation, research, policy, operator interviews, the whole ecosystem. The one thing that helps me actually stay on top of all of it is Tricycle Day. It's a 3 times a week newsletter that tracks all of the psychedelic movement across the country and really around the world, from clinical breakthroughs to shifting policy to what's happening on the ground right here in Oregon. So if you've got someone in your life who keeps asking you questions about what the hell is going on in the psychedelics ecosystem these days, I know I have those people, you know who you are, but you're not sure what to do with them or what to send them Tricycle Day. tricycleday.com. Now, here's Amanda. All right, Amanda Gao, thanks so much for coming on a Ground Game. I really appreciate you taking the time.
Oh, thanks so much for having us. We're excited to talk about Bendable and all things psilocybin.
Yeah, definitely, definitely. So, you'll be one of the first guests that I've had on that is really in the driver's seat, not just only in the, kind of service center lane, but even more so in the wraparound services that are talk therapy that I think you have a lot of experience and can make really important points around the value of really integrating aspects of the therapeutic behavioral health world along with the psilocybin therapy program here in Oregon. So in that regard, I'm curious, could you give us a little bit about your background psychedelics, and like, how did you find yourself into this place? What made you want to get involved with, the Oregon psilocybin program out in Bend?
Well, I think that actually dovetails really nicely into, why the Bendable model is the way that it is, and like why
Yes.
we decided to set it up in the way with a therapeutic lens. So previous to being in the psychedelic space, I actually worked in youth services. So I spent 15 years as an executive director in various youth serving organizations, working with individuals from complex backgrounds. And I worked in high trauma spaces. There was a lot of vicarious trauma that came through, and and I saw a lot of people who were struggling and who the tools that we had for mental health weren't robust enough to help with the complex trauma, complex PTSD. So kind of through that, I've always been a little bit curious about psychedelics. Like, this goes back to turning 18 and going to school at U of O. So where there is kind of like this psychedelic culture that was always a little bit in, in the U of O world. So I've always had like an interest in psychedelics from like a curiosity standpoint. And I like grew up in Oregon. So I think that, a lot of times it was just around, like kids go into the woods and doing mushrooms and, kind of like having those experiences. So I've always been really interested in it from an academic and just a curious standpoint, and was always just curious when people would talk about psychedelics or those experiences. And so I did spend a lot of time myself just like pre it becoming legal of like being interested in it and learning about it and reading books about it and listening to podcasts. And it's like really interesting now. There's always been, some of the Ram Dass and all of these texts and whatnot from, the Timothy Leary days, as well about the psychedelic movement. So, but a lot of that was really dated. And it's like interesting now to see just how much, how many podcasts and books and whatnot that are available. But when I was in my 20s, that really wasn't the case. So, but it was always just interesting for me. And then again, like working in these nonprofit spaces, I was working with folks and I was leading teams of mental health professionals at that time. So had a lot of, LPCs and LMFTs on my staff who were working directly in client care. And there was always just this kind of lack of a really robust tool. And everybody was always, curious about other treatments, other things that could be helpful, and then when psychedelics started to kind of gain some movement and we started to talk about this. And also, I guess I should say at this time, I transferred right when Measure 109 was starting to percolate a little bit, which is like the first time I ever heard your name. And it was like curious because I told my husband who's really into kind of like politics. I was like, I need to know Sam Chapman. I want to talk to him. And I was like, and I don't know where it goes, but I know that we're gonna end up being friends. So at that same time, though, I was working for a military organization that was working in direct service with young victims of human trafficking. So a national organization. So kind of two sides. I was working with victims who were coming out of really severe abuse, and then also with retired or current military folks who were part of the operation teams. And so on two sides, I was watching mental health needs not be met. I think it was, I would say every week, somebody from my team was losing a close friend to suicide. So, and then there was also this really interesting time when I would start to hear about, veterans going down to South America or Mexico for these retreats. And I was like, this is really interesting. What's going on? And so I just started to get really curious and wanted to know more about the mental health side and the mental health benefits of psychedelics. And that took me down a really, a very fascinating and obviously life-changing for me educational path. And I was also at that time, the pandemic was happening. I was pregnant with my daughter, and I knew that I was going to be making a career shift. My job previous to that was this national job where I was kind of running around the country doing a lot of things. And I wanted something that would be a little closer to home that I could still pour myself into. I jokingly told my husband, don't worry, I'm not going to be an executive director of an agency again. I'm just going to,
famous last
I'm
words
going to
of
keep
all
it
of us.
small. Yeah. And I loved working with my mental health team. And I'd always been really fascinated with mental health. And I was like, I think I want to be a therapist. And is what I really want to do is I want to be a therapist who is, open and interested and educated around psychedelics. And so that I could simply be, originally, my plan was to be a therapist that would work with preparation and integration and then kind of leave the psilocybin sessions to other folks. But that's what I wanted to do. I was like, I can be that person for people. I think that I have this really long history of working with folks in complex situations. I am psychedelic friendly, and so I'm going to go back to grad school. So I interviewed all sorts of graduate programs around the country and was like, hey, this is what I want to do. And there was one in particular that said, that's amazing. We really want to like walk beside you and help you learn and grow in that field. And like,
Cool.
as a shock to most people, that was the University of Louisiana Monroe.
Oh, wow. Okay.
So
Okay.
Louisiana came through for me, and it was like I was like, oh, that's interesting.
Yeah.
So I started my graduate school program there, and then about a year into my graduate program, watching Measure 109, I realized pretty quickly that all the people that I had served previous were probably going to be left out of treatment options because of the expense. And
Right.
I don't want to say that I think that treatment is inappropriately priced. I don't think it is at all. These are very expensive modalities, especially like through the bendable model to do well, paying professionals to hold this work, the amount of time that people spend in our program. So I don't think that it's inappropriately priced, but I knew that folks weren't going to be able to afford that.
Right.
So then my business partner, Ryan Reed, and I in my kitchen, my daughter at that point, I think was like a year and a half old, broached the idea of starting a service center that had a nonprofit as well associated with it. And Bendable Therapy was born in my kitchen. And I remember like yelling over to my husband, I think I'm going to start a service center and it's going to be a small nonprofit. And he was like, okay. And his exact
Sounds
words
good.
were, sounds good. His exact words were, I can't wait to see how this gets away from you. Like, and I was
Shots
like, don't
fired.
worry. It's just going to be really, it's so small. And then Bendable Therapy has grown into what it is today, which is an active research site, a robust nonprofit that serves hundreds of clients. And I'm really proud of what we've built here and the community we've been able to serve, and that we are a psilocybin assisted therapy model.
Yeah, yeah, so incredible. So I want you to kind of break down a little bit more about the unique nature of the bendable model. But before we get there, you had said something that really resonated with me that I think is also somewhat of a rare but important perspective in the Oregon program right now. And so, I think it's what, like 20,000 people have been through the Oregon program estimated at this
Yeah.
point. The
hmm
safety, data that's coming out of it is incredible. Like I'm starting to see some stuff that we might even have a better safety record than some clinical trials at this point. Like, TBD,
hmm
like I don't want to, put too many words in
Yeah.
my own mouth without verifying all of that, but it's looking really good, especially on the safety front. Folks like you are starting to produce, research that's really justifying and amplifying the efficacy case.
hmm
And, one of the things that I'm really, interested to dig in with you on is the question around cost, right?
Yeah.
And something that obviously Bendable exists to address, right? And when I think about this, there's two lanes of thinking generally around cost when people are asked what they think about the cost of the Oregon program. There's the very common lane, which ends up into a negative perception, though is sitting in reality to some degree, which is, the average price of psilocybin services is out of reach for, folks who probably stand to benefit more than anybody else, right? I mean, the ballpark anywhere between 1,500 and 3,000. It goes a little bit further on either end, but that's out of reach for a lot of people. And so therefore the program is unaffordable.
Yeah.
And that's the end of the sentence. And I, while there may be some truth to that, the second half of the sentence is compared to what? Right.
Right.
And I think that's one of the perspectives I'm really interested to, especially for someone like you who comes from, that behavioral health background. And that's really where you started and what you saw. It feels like there's opportunities in like shifting the narrative. Like, okay, let's acknowledge, yes, like we need to continue to address this cost. But maybe one of the ways we do that is by finishing the sentence with it's, expensive compared to what? And what do we compare these things with? Is it still expensive in a different limelight? Like how are you thinking about those cost questions in the day to day and within the Bendable model?
Yeah, and I think I really love the like compared to what, because it is curious, like, you know, for the bendable model, which is again a bit different than other folks, but our cost per individual session is $3,800.
Hmm.
And that's us keeping our cost pretty low. Honestly, I
Right.
think it should be closer to 5,000.
Sure.
However, we do try to, support people with scholarships when we can and whatnot, and that these costs are appropriate, like I said, appropriately priced for the amount of time that someone spends in the program, the access to care that they're getting, and you. But I think is what people are curious about. It feels like a big out of pocket cost for something that we can't guarantee a result, right?
Sure.
Like, so because in compared to what, like, I just got a quote for this new dental crown that I need, and it's about double what a
Sure.
psilocybin session is. But I know that the crown's guaranteed to work, right?
Right.
And so things like, dental surgery, LASIK eye surgery that are often out of pocket costs that aren't covered by insurance generally. This is in that same vein of like, it's not necessarily that it's more expensive than any of these other out of pocket health expenses or even mental health. I mean,
Right.
yes, does insurance cover mental health? Absolutely. And not for all providers. And, this is like the curious thing, not all therapists are a good fit for someone. So sometimes you find the therapist that really works for you, but that's going to be an out of pocket expense at $200 a session potentially, and especially then if you get into some of the more specialty treatments for mental health, like EMDR or something for trauma, which, those sessions can, run up to $250. And finding somebody, I'm trained in EMDR, so I know this world specifically, but it's, finding somebody who's trained in EMDR in your community can also be really tricky, let alone someone who takes your insurance. And yet we know it's a really highly effective treatment for trauma. So I think that, in comparison to what exactly, and I think this is like a larger question about healthcare in general, and the inaffordability of a lot of things that that I think, should be basic human needs.
Right.
I think, people should have access to the care that they need with trained professionals that they align with. That there should be agency there to be able to select your provider, select, your facility to be able to, go through those experiences of working on your mental health with somebody that you align with and that you feel safe and comfortable with. Of course, meeting industry standards and whatnot. And I think that is where, psilocybin services in Oregon gets a little tricky because the model isn't a medical model and it's not a mental health model.
Right.
So, where you go and what you're seeking, there's a lot of variability within the Oregon model and in options available to folks. And folks don't necessarily, as much as we've tried to do a lot of education around psilocybin services to the general public, there's still a really lack of understanding about how psychedelics may or may not help and where and why they may not help. And then again, like having it puts a lot of burden onto the client to go and do that research on their own to find a facility that aligns with their needs. And so, then you get into cost of like, well, oh, this place is $1,000 and you're X amount of dollars. And it's like, well, where's the difference? And that's, it puts the onus on someone to find out why that might be different.
Right. Well, let's dig right into that, because I think that's the core of the Bendable model. Like what types of what clients are a good fit for the Bendable model? What type of clients are you seeing come to Bendable, and what does it look like in terms of getting connected with Bendable, kind of start to finish? Someone's curious. How are people finding Bendable? Let's just start there. How do people come to you?
Well, they either hear about us on a podcast or something that's written about us or a Google search, so, however they're finding us, whether it's through and actually I will say that we receive a lot of recommendations from other therapists.
I was curious about that.
Yeah, I would say about half of our clients come as a recommendation from their therapist. So we do a lot of outreach and education to other mental health professionals to say, hey, we are an agency run and staffed completely by mental health professionals. Right. So there is, and that we are here to, support someone on their mental health journey. We're not here to replace you as a therapist, but we're here to be that support. Just like I kind of always, the metaphor I use is that your general practitioner is your therapist, right? It's the person you see regularly that you're working things on. And sometimes your general practitioner refers you out to a specialist for something. So but it doesn't mean that you stop seeing your general practitioner. And sometimes those results are sent to your general practitioner and you continue to the work, after, you go and see a specialist for a piece of work. It's the same thing with psilocybin services. We are a mental health agency. We do work well with and integrate with your already existing mental health plan, but we're not here to replace it. So typically when people either get that referral to us or they find us organically, then they will sign up for a consultation call with me and I'll just discuss with them, like, tell me where you're at, what's going on, and then I give them my best advice of what we know right now. And I base a lot of what I tell people off of existing research, what we've seen in our practice and other folks doing research. I mean, this is a wonderful part about psychedelics right now is we are seeing this, a large amount of research, even though it's still very small in comparison to what we need, but there is so much happening in this space. So it is, I'm able to resource people to help them make an informed decision for themselves. And once they do decide to move forward, they feel like this might be a good fit based off of, what they've learned from me and potentially what they've talked about with their mental health professional that they are working with. And they decide to come to Bendable. They go through an intake process, an application and intake process. And then we use that information to match them with somebody from our team that best fits their needs. So everyone who works for Bendable is a licensed mental health professional, and they're all in private practice on their own as well. So this isn't their full-time business. So everyone is taking a couple of clients and everyone has their specialties. We have folks on our team that specialize in trauma or addiction or depression or life transitions, end of life. So we kind of have clinicians on the team who specialize in a variety of different mental health conditions. And so once that facilitator is then selected, they are paired together. And from there, they start extensive preparation. So whereas the organ model is pretty limited, there's, the requirement of one preparation session, which is largely paperwork,
Right.
and then a psilocybin session, and then an optional integration. Our program is much more enhanced to say there's extensive preparation, the psilocybin session, and then in-depth integration, including one-on-one integration and then small group integration that folks are invited to these. They're open groups, but it's closed within the Bendable community. So anybody who comes to the Bendable has access to our integration groups, and those are virtual and in person every month. So they can have continued support for as long as they need it.
Right.
And we don't take a high number volume of clients. We're not a clinic that's just trying to do high volume. We're taking a deep dive. So when folks get to us, I know all of our clients by name. I could have somebody who calls me from a year ago, like, oh my gosh, of course I remember you, because we are taking such a deep dive with our clients. And then, I am always kind of in the background as a resourcer and supporting people and helping people through. And then they have their facilitator that's also with them for their period. And I would say that people spend anywhere from, around 8 to 12 weeks in the program. So it's not, it's lengthy from consultation to kind of wrapping up their formal integration. And some people continue on in integration groups for years. I have people come back regularly. So that's a little bit that's enhanced our model.
Right. Yeah. Well, and this is what, really brings up the philosophy that feels like you've embodied in Bendable, which is doing a really good thing a really hard way, right? You're not taking the shortcuts, right? And that's not to say that, there aren't people who maybe are seeking, spiritual enlightenment or doing this for wellness, right? Where they don't need as much, but I'm curious to hear more about, both kind of the prep and the integration, especially from the behavioral health side of things.
Yeah.
I mean, why are you investing more on the front end and the back end? Are you seeing different types of results in terms of that type of quality and that many touch points? I'm curious to hear more about the philosophy behind going that extra mile, if not extra 10 miles. I mean, it really seems like you're not prescribing a regimen to someone and then finding out whether or not it works. You're kind of meeting them where they're at, and you're along for the journey as long as that journey needs to go, both pun intended and not, I guess.
Yeah. I think I've always just seen this as a therapeutic tool. And that's where I really wanted to orient from is how do we how do we put the therapy first, right? And psilocybin is a tool, but I think that from what we are seeing from our own research and starting to see from others is that, I mean, there was just recently in April, I believe, of 2026, a psilocybin and depression article or research paper that came out that wasn't Bendable. And it's just reinforcing what we've built at Bendable. The outcomes in psychedelic therapy are not driven just by the medicine, but rather through the depth of preparation and integration. And I think is what we really want to see for folks is, we want, psilocybin is a really powerful tool. It doesn't mean that it's going to be the tool for everyone. People are going to come, they have these experiences, and it's a spectrum, right? Some people get that home run where they're like, that was absolutely everything that I needed. And then others are like somewhere in that continuum. I can say that in hundreds of sessions, nobody's ever told me that they didn't get something out of it, right? And I think this is what we've just seen is that through preparation and integration, that we can, set up our opportunity for the best possible outcomes and long-lasting, enduring results through this model. And it's not to say that you can't achieve some of those same results in another model, but I think when we're talking about just overall, when we're taking a broad spectrum of like, how do we want to best serve clients?
Right.
Yes. Do I think that there's an individual that can go through a program and like absolutely have that breakthrough and like that's what they needed? Absolutely. But in general, when I'm saying a general population for mental health, this is what is needed to help folks get the most out of this tool.
Right. Yeah, definitely. Well, that takes me, I want to hear more about this research that you've been up to. And so let me see if I can share my screen here and see if I can pull up the Bendable website and have you walk through this beautiful website that you designed yourself, and this study that you just had. It looks like it's in preprint, but
yes,
so walk me through this a little bit. I mean, people can obviously read what's on the screen, but why did you want to do this study? Who is this study for? What's the design, and kind of what are the top line takeaways from the study?
Yeah, I think so. Again, to my husband's credit, he knows me well, and he knows that when I start something, I'm just going to go all the way on something. And it was pretty quickly at Bendable that we just didn't have, people are like, well, what's the efficacy on this? Like, what do we know? And I was like, well, Oregon's the first state to ever do something like this. We have no idea. Like, we don't know. We have clinical trials, but they were pretty minimal even at that stage, as you'll remember, there wasn't a lot of information to point to. And we're like, we kind of just had our gut instinct and a lot of, folks from the underground spaces and indigenous practices, which again, like huge amount of information coming from like indigenous, communities. And yet we couldn't say like, oh, well, look at, here's this data. So it's like, this is a Western world. I'm using this as a tool in a Western model of therapy. So in that, like research becomes really important to people, and it, helps legitimize the Oregon model. I wanted to see the Oregon model be successful. So I thought to myself, well, we should probably do research. And so I like to have really grand ideas. And then Ryan, who's our operations director and just an absolute like genius at all things spreadsheets and organization, takes my ideas and makes it possible. So without him, I would be lost.
I can vouch for Ryan's genius engineer brain for sure.
Yes.
Ryan.
And I was like, I think we should do this. And he was like, okay. So we were able to set up, a full IRB study and get that approved and find funding for this. And it was in-house. And it was just our clients who were coming through who were offered the opportunity to participate in this research. And, we didn't know how that would go either. It being like, hey, would you like to participate in this first of its kind ever research? And people were so excited to participate because it really spoke to me about the trust that they were putting in Bendable and the trust that our clients have in us, which I was just so honored that they felt so safe to also then participate in this research, but also that they were like, hey, we recognize we're some of the first people to go through this model, and we wish we had this information. We want to know these outcomes. And so if our experience can help other people, decide that this is, a tool for them or not, then absolutely. So it was pretty great to see that people were really willing to come through this study. And we had great completion rates on all of our surveys, and people were just really engaged. So, I mean, I think what really spoke to me about this is that this is a real world population, right? You know, clinical
Right.
trials typically exclude people that are on psychiatric medications who have, you know, coexisting mental health diagnosis, and nearly half of our participants were on mental health medications, and it
Oh,
was
wow.
mental health medications all over the board, right? Like, you know, some people are on 20 milligrams of Lexapro, some people are on 200 milligrams of Wellbutrin. It was so all over the board. So it was really wonderful to see, like, this, these are just people who are coming. You know,
Right.
there was no one had to titrate or off of a medication. We met people where they were at. You know, these were people who were coming with all sorts of different, you know, mental health diagnoses, although we didn't specifically collect their diagnoses, but they self-reported.
Right.
So it was, you know, really curious to see how well people did through this process, whether they are on mental health medications or not, you know, a mental health diagnosis or not. And then the numbers were really striking. And again, this is the enhanced bendable model, and more research is needed to know, can we achieve these same results outside of our enhanced model? I'm very
Mm,
curious to see that.
sure.
Um, and I'm very curious to see, as other studies start to come out, that reinforce the bendable model. And maybe this is, you know, we can help everyone, you know, just giving people information of, like, how do you want to set up your own practices, and how giving clients this information so that they can make an informed decision on where they decide to go through these sessions. So,
Right.
but yes, the numbers were striking. You know, depression and anxiety scores dropped by roughly half.
Wow.
Well-being showed such a large effect size, you know, and they weren't subtle findings. Like 70% of participants went from significant anxiety to minimal anxiety in 30 days.
Whoa.
And I think most importantly, something you touched on earlier is the safety story.
Right.
Adverse events were rare and minimal,
Right.
you know, so it's, and when you talk about, you know, mental health medications and kind of other treatments for mental health, you hear a lot of people who that, you know, mental health medications come with a lot of side effects for some folks, you know, and or aren't as effective for others. So this is, it's safe, it's effective, it's, you know, it's a one-time ordeal. You know, it's not like we're asking people to come back for multiple sessions and spend all this time and money. It really is this one big investment of time and money that can achieve pretty long-lasting results. And again, some of the limitations are of our study, you know, that we only follow people for 30 days. So I am curious to see, you know, if, you know, studies, and we're working on potentially setting something up as well for this, but like, what is it like, you know, at 6 months? What is it like
Right.
at a year? And anecdotally, I can speak to that. I see a lot of our clients still, and people have long lasting, enduring, you know, positive effects. But again, you know, this is just my anecdotal evidence, and I'm really curious to see some more robust studies.
We're going to take a quick break. Amanda has been talking about what it takes to actually get someone into a psilocybin session, all the way through the real integration process. And that's exactly the problem that Althea is trying to solve at scale. Althea is a platform that connects people to legal psychedelic care in Oregon and Colorado. They've built the infrastructure to help people find qualified providers, understand what to expect, and to navigate the process from first question all the way to follow up. If you or someone you know has been curious about legal psilocybin therapy in Oregon or Colorado and isn't sure where to start, Althea is the place. You can find them at althea.com. That's ALTHEA.com. All right, now back to Amanda. Well, and you have a new study that you're recruiting for, which is interesting. And I will say, so the
Yes.
first guest that I had on was Dr. Adi Ray. And I
Oh,
have heard about psilocybin and pain for a little while, but I've mostly just been hearing about it. I have not actually heard credible folks in the field like put real full-throated kind of like emphasis behind doing that research. And I asked Adi Ray, like, you know, in the research that she's been doing over at Open, what's the biggest surprise to you that you think may be the case, but you can't prove yet? And she thinks
hmm.
at psilocybin for pain is what she said. So when I was perusing
Yeah.
your website before this, I was very excited to see that it looks like you're jumping in that boat too. Like, very cool. Like, tell me about this.
Yeah, so this is really exciting, and this is kind of one of those interesting research projects. So at Bendable Therapy, like we ran our own research study, but then we've had some interest from other folks who have curiosities about things to run their research study with Bendable. So
Right.
that's one of the CRPS study was brought to us by someone. They're like, "Are you interested in um, investigating this with us?" And we said, "Absolutely," because I am. I am with AD Ray on this one. I think that this is going to be one of those curious places. I think there can be a lot of benefit here. So
Right.
CRPS is complex regional pain syndrome, which is a
Okay.
chronic neurological condition that causes severe and prolonged pain,
Hmm.
typically in one limb or another. And it
Oh,
usually
wow.
develops after an injury or a surgery or a medical event. And it's pain that is much more intense and long lasting than the original injury. And there's really not a lot of support that can be done for it. And it's debilitating. Working, the folks who have come in to be a part of the study that are seeing it's just their stories are heart wrenching. And so CRPS to me is kind of like at the end of this continuum of like it's a pretty severe pain disorder. So to see what psilocybin can do here would give us some clues as to what would potentially be possible with psilocybin in all areas of pain. So we're very curious to see what we learn through this. And again, we're in active recruitment right now. And folks will begin having their psilocybin sessions this summer.
Wow.
So we should probably be able to have some preliminary data towards the beginning of 2027. And then we'll look to publish, in the spring of 2027, hopefully.
Wow. That's incredible. Exciting. Well, and I'll make sure to include all these links in the show notes too, in case people
Yeah.
think they might qualify and want to apply, or they know someone who might
Yeah.
as well. We'd love to
Yeah.
continue to help push as
And the
many
great
people towards that as possible.
Yeah. The great part about the CRPS study is we're very fortunate to have funding to fully fund the psilocybin sessions and $1,000 travel stipend for folks. So,
Wow.
you
Incredible.
know, yeah,
Incredible.
we're very, very lucky to be able to provide that. It always makes it always makes it a little bit easier for folks
Sure.
to be able to, have those benefits.
Yeah. Yeah. Absolutely. Um, so switching gears a little bit from like what the case for efficacy seems to be setting up to some degree, this is something that I'm really interested in kind of digging in on. I'm curious to what extent you've thought about this, or you've started to see some of this information come up in your research. Is the fiscal case for psilocybin
Yeah.
therapy? That's something that I've, I think, the efficacy has gotten us to where we are today and is going to continue to help pave the path. And as someone who has been monitoring state level psychedelic legislation for the last 5 years, it's becoming very clear to me that one of the number one killers of legislation isn't that we could make a convincing efficacy argument. It comes down to the state asking, well, what's this going to cost? And how are you going to justify it? I'm curious, based on what you're seeing on the ground and just your day-to-day work and also your research, do you have a sense as to whether or not there is a equivalent cost comparison for psilocybin therapy for certain populations or certain conditions, compared to what the state might be spending or what private payers might be spending? There's a lot of ways to cut up this pie, obviously, but I'm just kind of
Yeah.
curious generally, like, are you seeing cost effectiveness, fiscal type of signals in the research that you're doing right now?
Yeah, I'm really unsure about that. Like I would really like to find out how many clients. I think this is again another place that some research would be really valuable is like what happens after a
Right.
psilocybin session. So we know that it's effective. We know that people are improving with the mental health conditions. And does that cut down on medication use, doctor's visits? And again, like I said earlier, we encourage people to go back to their therapist
Right.
and continue with therapy, but does it shorten the length that they need to be in therapy? I know that as a therapist who works with folks in integration, sometimes I feel like with my clients who have gone through a psilocybin session, and then they've had a psilocybin session and then they come to me for integration services as just a counselor. Sometimes it feels like I'm doing 3 months of therapy in one session. Like the
Sure.
breakthroughs are really quick. Like we're getting resolution. We're seeing things differently. Like it's like we're moving at such a quick pace. Like I've definitely had sessions where I was like, wow, like it would typically take me months to, for us working together, for us to like get to this place. And it's happening really quickly. So does it cut down on therapy time? Potentially, so sessions, the number of sessions that maybe somebody needs. I say that yes, after a psilocybin session, absolutely return to your therapist, but do you need to be there for the next 2 years? I don't know,
Right.
or is it more like I'm going to go for 6 months and I'm going to really integrate this and then I'm feeling like, okay, as a therapist, Tom, I was like, therapy never ends. We just keep peeling back the layers.
Sure.
But for some people, like, that's maybe a different kind of therapy than what a lot of people are trying to do, right? It's like I'm here because I have this concern and this issue. And once that resolves, I feel pretty good.
Right.
And like as a therapist, our goal is to like teach people to ride the bike on their own. Like I don't want you to need me forever, right? Like if you want to come back later and do another piece of work because something else happens, absolutely. But like ultimately, like I want my clients to graduate from therapy. That's
Sure.
my ultimate goal, is for them to feel safe enough, well enough, and have the tools and the resources that they need to navigate life
Right.
on their own. So I have a lot of questions around, is this cutting back on the mental health costs? My hunch is yes.
Sure.
But that's just again from my vantage point, what I'm seeing is that, I believe that there is going to be some cost savings there. And I do think that, as a tool for healing, trauma, addiction, what we would refer to as treatment resistant conditions, like if we can give people, even getting people, who are coming in here and getting them down a little bit lower, like their ability to participate in the community, to work, to parent appropriately, to not incur, hurt people. So like,
Right.
are we healing things that are like creating long-term positive benefits in our community? 100%.
Right. Right.
Do we love preventative medicine? Not really. Like, so it's like when you want to talk about like, are we healing generations? Are we like, are we helping people get back to a more robust life where they can be more, positive community members, family members, parents? Like, I know that's true. I know that's true. Now, is that something that the state values? We'll see.
Sure. Yeah, totally. Yeah, no, that's a fair and honest account, I think, right? Is it's really easy for all of us to get over our skis and pushing what we think is likely going to be the case. And we have to be incremental with it, especially with decision makers and who will necessarily have, not only short time spans, for digesting complex information that we give them, but also, there's a lot of priorities right now. The state is also in a massive budget crisis. There's few states that are not in a
Absolutely.
massive budget crisis, right? And what's getting cut
Yeah.
right now? Fundamental healthcare services, right? And
Right.
so, as someone who is, very interested and focused on trying to make a fiscal argument, I'm also not naive enough to think that this might be the craziest time to be asking these questions, or maybe
Yeah.
it's the perfect time to ask these questions. I don't know,
I
but
think we can
I'm going to
always
find
ask the
out,
questions.
right? Let's find
Yeah.
out. Let's find out. Yeah.
I think if we don't ask the question, we will never find the answer. And if we don't ask the question now, then we can't, we can keep asking the question until it makes sense. And like, as an Oregonian, who deeply values some of the things, these you social safety nets that are available to people, and watching those, decrease funding, I absolutely want the funding to go there.
Right.
Psilocybin services is amazing. I love them, obviously. But when it comes to like, social services and, the Oregon health plan budget and all these things, I absolutely want that, like the money to be funneled there as an Oregonian. So,
Right.
and I still want us to have the conversation, because maybe there will come a time when the time is right. Or I don't know, like there's, all things are possible, I suppose.
Right. Yeah. Well, it's the question that I'm going to keep asking until I'm really tired of asking it, which is going to be a while, which is, can psilocybin therapy be just as effective, if not more effective, for the same price point, if not less than what the state is currently spending? And also not just the state, right? I mean, well, and actually, let me ask you this. This is an interesting off the top of my head question. Have you had any conversations that you can talk about? Obviously, you don't need to talk about anything you're not supposed to talk about, of course. But I'm really curious if there are, plays to be made at the private, insurance level. Specifically, I'm thinking there's a couple pretty big, powerful unions, some of which endorsed Measure 109 and donated to the campaign, that I bet have some members that might be interested in advocating for having psilocybin therapy added to their coverage for a whole host of different reasons. I'm curious, have you thought about or talked with anyone inside or adjacent to the private payer world, and what are they thinking, if at all? Are they even thinking about this? Are their members bringing them this conversation at all? That's something I'm really curious about.
I'm also really curious about this. And to my knowledge, I am not a part or privy of some of these conversations.
Sure.
I would love to be. So if somebody's listening and they're like, we want to ask, I'm happy to weigh in on that. And I'm really curious how it would work because, Oregon is a non-medical program and it's far from a medical one. So,
right.
And I do think that the private insurance is probably the easiest path forward right now, because they can. Yeah. And they do have the money to do this, and it would probably save them, in other costs, and they can pretty quickly decide to do that without legislative action and all of these different things. So I think that is probably the easiest path forward. Now, who are they going to reimburse? Where are they going to reimburse? Because typically with, to get insurance reimbursement as a therapist, I need a diagnosis and a treatment plan. Right. And I have to, submit documentation towards that to be reimbursed. So does that mean places like Bendable are going to be, welcomed in? Is it only that certain clinics are? I think that's the conversation that they would have to have, which I think is really interesting. And honestly, one of the easier solvable problems, you can, say, okay, because now that, this last December, and when it went into effect after the new year, was the dual licensure protection at the state, that really does create this interesting space where now we do have the ability to be dual licensed in the state without worry about our clinical therapy license in jeopardy. Right. So, I think that's a pretty easy problem to solve, much easier than maybe the Medicaid question, so at the state level. And I think that's a place where if we could get some folks involved in that, or, and interested in that, I think that we could really start to change who has access. Because even though not everyone has access to private insurance, if you have private insurance, it then means it's not a completely out-of-pocket expense, and that creates a completely different conversation for your average Oregonian, or and if that insurance was accepted from outside of the state, then your average person in the United States.
Right. Well, not to mention and again, I'm really just thinking outside the box. This none of this is scripted, folks. I can promise you that. If with the research opportunities that would exist within private payers starting to dip pinky toes in the water, and I'm thinking about firefighter unions. I'm thinking about frontline healthcare work. These are some of the biggest, most powerful unions in the state, who have all of their members to some degree are suffering from some type of behavioral mental health type of crisis, if not on a regular basis, right? And so it seems like figuring out how to approach them and asking and talking to some members, and maybe that's if you're a member of a union in Oregon, or really any state for that matter, have an employer. It doesn't have to be a union, right? I just think about unions generally, but it's big employers, right, that have private insurance, offerings. If you are interested in having a conversation with your employer about adding this, please reach out, because I'm really curious to see how far can we push that envelope? Have people done it in the past? What employers maybe are already covering ketamine assisted therapy, for example, right? That would be a low hanging fruit place to start. And I don't know, that kind of stuff gets me excited because it feels like there's a there. I think you are probably right that starting with private payers and employers coverage is probably a more incremental step in theory than going straight for state dollars. And yeah, that's a fun one to think about.
I agree with you. I think it's a logical next step. And all that to say, we have no idea what's going to happen at the federal level with like the
Right.
descheduling and the different things. So like,
A lot of
there's
people
a
think
lot
they
of,
know.
I know.
I am not
If
one
I
of them.
know, if I know one thing about
Right.
this government is that
Right.
I
Yeah.
don't know what they're going to do.
Yeah, that's
So,
right. That's right. Yeah.
I think there's like a lot of things are possible right now, but it is legal in this state. So,
Right.
could insurance that is in the state of Oregon, private pay, add that in? I think so, but again, I'm not an insurance expert, although I
Mhm.
deal with billing all the time, and
Sure.
for better or worse. But at the same time, like I think that's at least an easier conversation at this stage.
Right. Right. Yeah. One final question on the billing, actually. Are people able to, like, so especially with the interaction between licensed therapists who sit outside the psilocybin program that are maybe referring into the program, how does that work for someone who has talk therapy outside of the psilocybin program, like, covered? That's good. They want to be referred inside the psilocybin therapy program through Bendable, let's say. Like, how is the insurance able to cover any of that? Like, how is that working these days?
No,
Okay.
and I think that this is an area that's being discussed
Sure.
amongst mental health professionals is like, where is that line,
Right.
right? Between what is like inside the box of preparation and integration and what is outside and just more,
Right.
we're integrating this experience that you had. So it's a little bit murky right now, I'll say, where is
Sure.
that line? We hold that at Bendable Therapy, we don't bill insurance. So
Right.
we've just kind of made this as like,
Yep.
this is the cost of this program. However, if you're, therapist, if you are doing what would maybe be considered additional prep and integration
Sure.
outside of the Bendable model, then that's fine. But it's like
Right.
also outside of kind of our set program. But I do think that, as this becomes more mainstream and more, like a standard that people are accessing these sorts of things, that there will be the ability to at least potentially cut down on some costs by billing for therapeutic sessions that dovetail into preparation
Right. Yeah. Totally makes
and
sense.
integration.
Yeah. Okay. Final question. 10 years from now, you're still running Bendable. The Oregon program is thriving. What exactly does it look like? What have you accomplished? What does the world look like for Amanda Gao 10 years from now?
Oh goodness, this is a great question. I would love to see Bendable continue to grow our research arm. I think this is something that's been really fun for us as a team, and then also just to continue to expand services for folks. I would love to, continue to advocate for, insurance to be able to cover some of this, however that looks. So I think, at that point, then it's a clinic with a robust, you know, program that folks can access pretty easily, that insurance is covering pieces of it, and that this is really integrated into a therapy model, and that the community understands how these go together. So yeah, I think it would just be continue to grow, and then potentially looking at as we grow Bendable and as more things become available, there's other modalities and medicines in the psychedelic space that I think are really interesting towards healing.
Right.
I know Ibogaine is something that gets talked about a little bit more and more, and for addiction, it is really such a interesting topic of conversation. So, potentially in 10 years, that's something that we also have like an Ibogaine treatment program, or,
Right.
something that as we know more about things. And so Venable is just really committed to staying at the forefront of being able to offer safe, effective treatments to our community members.
Yeah, absolutely. I mean, I think that's one of the primary things that, Oregon, Colorado, New Mexico, other states that set up these psilocybin programs have to offer, ibogaine specifically, which is going to need different types of parameters, et cetera. But, we've got the infrastructure, we've got the scaffolding, we've proven the functional model. We have work to do in meeting the people where they're at to get them access to services financially and otherwise. But, I would definitely love to see the psilocybin programs build enough scaffolding to continue to, responsibly add additional substances, especially as we continue to see the research from clinical and elsewhere on a whole host of different psychedelic substances that, when put in the right setting, with the right guardrails, can do a lot of good for folks that otherwise don't have that many options right now. So it's exciting times.
Absolutely. I agree.
Right on. All right, Amanda. Well, that's our time here. Thank you so much for coming on. We'll make sure to include everything in the show notes here. And any final things you want to let the audience know before we wrap up?
I have one curious fact is that I just saw recently that 17% of facilitators are now licensed mental health professionals. So I was really
What?
curious to see that kind of
That's
as a shift. I know Bendable is a little chunk of that, so I'm excited to see this trajectory towards mental health, but I think that's something to keep an eye on as well as this program evolves.
That is definitely, if you would have asked me to guess, I would have said less than 10 percent.
Ooh.
So 17, that's pretty good, especially given that, we just kind of changed some of those rules to allow for dual licensure and things like that.
Mhm.
So shout out to all the good people, yourself included, that have helped make that happen. And yeah, we're really lucky to have you in this space, Amanda, here in Oregon.
Mhm.
And
Thank you.
the best to you and Ryan and the whole team out there at Bendable. And yeah, thanks for coming on. I'm sure we'll talk again soon.
Absolutely.
All right. Thanks, Amanda.
Talk to you soon.